But that connection with the community has always been very obvious in Chesterfield, but never more so than this year. We've had a complete torrent of donations and messages of goodwill. Everybody who's been able to sew or paint or crochet has made contributions of things that have been so helpful and so much appreciated. In fact, I remember writing to one of our members during this time to thank her for the PPE she had sewn, and I got an automatic bounce back on the email that said, please don't be bothering with me with emails unless you can sew, because I'm very busy. But if you can sew, you should really persevere in trying to get hold of me. And I thought that so captured the moment of and the spirit of the trials and tribulations we've had during this time, with everybody really rallying and coming together. So a huge thank you to the whole community. I should also mention our local hotel and local pubs and restaurants and takeaways who have, over the 6 months, continued to turn up at our front door regularly, offering meals and other comfort and support to colleagues at the Trust. We've also had donations from shops of food and items of clothing for patients who weren't able to be visited during the time. So it's been all that practical support and assistance, along with the messages of goodwill, that have made this time, humbling. And we're so grateful. And I think it's no exaggeration to say that we wouldn't have been able to look after critically ill patients in the style and manner in which we did, was it not for the very true and genuine partnership we've had with the community. And we're so grateful. It won't surprise you to know that our staff colleagues were at times overawed by all this generosity and goodwill, and in their inimitable style wanted to give something back. And there was a lovely situation where, I can't remember if it was June or July, but it was one of the summer months, where the staff contributions to the Chesterfield Food Bank exceeded the collection, the size of the collection we made at Christmas, which is always really a bumper one. So I think, staff finding a way to pay back and reciprocate some of that kindness and generosity that came from the community had a lovely kind of sense of symmetry about it all. The other thing that's really struck me over the period is the fact that we can be guilty of referring to some of our colleagues as back office staff. For instance, some of our colleagues who work in our wholly owned subsidiary, DSFS, we say, they're providing, back of house services. And I shall never describe anybody who works in the hospital again as providing back of house services. And too numerous to mention, but I do have to highlight, for example, our procurement function. There was such a lot in the newspaper, wasn't there, about hospitals running out of PPE. At Chesterfield, we ran out of one item of PPE for 2 hours on one occasion at the very beginning of the outbreak. Such was the ingenuity and innovation and relentlessness demonstrated by our colleagues in service, I hasten to add, not only of the Trust, but which enabled us to be able to share PPE with other NHS providers in the county. So that was amazing. As indeed was the speed with which different areas of the hospital were cleaned and facilities made available really quickly. So the cleaning staff were not only magnificent, but they were relentlessly cheerful. And again, of course, we couldn't have managed it without them. Have to say a word about those who stayed at home, because you'll recall at the beginning of the outbreak, it was really important that people stayed at home to save lives and to protect the NHS. And we had lots of colleagues working from home who, quite frankly, would have much preferred to have been in the hospital. That's just the sort of place it is, and they're the sort of people we employ. But they did, hugely ably supported by our IT colleagues, who kind of transformed our ability to work remotely virtually overnight. And for those colleagues to find a way to be so effective in such a short space of time. And I think that has to be said also of my colleague board members, but particularly of our Council of Governors. The Council of Governors have more or less performed their duties seamlessly throughout this whole period. We've managed to continue on with Council of Governors meetings and updates remotely and on video link and what have you. And they have been recorded, and I think they're still available on our website if anybody wants to get a glimpse. But you know, at times of crisis, it's very important that we continue to be held to account and that we stay in touch with the issues and concerns in our patient population and in our wider community. And finding a way to do that, I think, was really important, and we were very glad we could. So a big thank you to our governors and our board who adapted in that way. So it's been a big team effort, as you can tell. We're so grateful, and as I say, humbled by everything we've experienced. We're going to give you a flavour this evening of how life has been for us over the last 12 months. But I think just before I pass on to our Chief Executive, Angie Smithson, to do that, I'd like to say that this kind of renewed and reinvigorated partnership we've had with our membership and with the wider community is something I'd really like to build on and capture. We're not going to be judged on how well we coped with COVID. Will also be judged on what the total mortality has been for the period in which COVID-19 has been in the population. And consequently, the restoration of our services is going to be hugely important and significant, because we need to be doing the right thing for people, irrespective of the condition they've got, and finding ways to get treatment levels up to the norm. And that's going to require new ways of working. And I think if we can continue this active partnership, we'll get feedback from you and we'll know what's really working and how it is we can make the hospital accessible to all with the usual high quality services you rightly expect. So we're glad you can join us tonight, whether you're on your sofa or sitting at your kitchen table. We hope you enjoy the presentations this evening and that you will continue to engage with us over the coming months. So on that note, I'm going to pass across to Angie, and Angie's going to introduce a number of videos which I hope are going to give you a real flavour of what it is we've been up to.
Thank you, Helen, and good evening, everybody. Hello, my name is Angie, and I'm Chief Exec at Chesterfield Royal Hospital, and I'm so pleased to be here this evening talking with you all. I'm sorry that I can't see you all. I know there's about 140 of you all sat, hopefully comfortably, ready to hear about some of the successes and the challenges that we had in the year 2019-20. I just want to say a couple of thank yous before I start to the team here supporting us in the studio. So thank you, Chris, Sarah and Nick, for making sure that tonight goes as smoothly as I know it will. And I want to thank Charlotte and Lauren, who you'll see later, our interpreters, who have permission from me to signal if I talk too quickly and enthusiastically about some of the great stories I want to share with you this evening. There's also, as Helen has described, been some challenges, not only through COVID, but we're reflecting back on the year 2019-20, and we know we don't always get it right for everybody every time. But what I don't doubt is that commitment and support from my staff, our population, and colleagues in other organisations in Derbyshire, who are all committed to making sure that we continually improve everything that we do to support our patients and our staff. So I want to continue the theme of thank yous and talk about our people. Our 4,200 staff do an incredible job across all our services in hospital, community bases and GP surgeries. Throughout the year, they've provided exceptional care to our patients in circumstances that have clearly not always been easy. Like many other trusts, we felt the pressure of growing demand for our services, caring for an increasing number of people in our communities with a range of underlying and long-term health conditions. More than 40,000 of them were admitted to our hospital, needing urgent clinical care. Along with saying thank you, the board's role is to make sure that all our people have an exceptional place to work. But just a few years ago, we were known as one of the worst performers in the country for staff experience, although our patients told us they were positive about the care they received. We've worked really hard to change this position and to balance those two sides of the coin. So last year, we were really pleased and honoured to receive a highly commended place in the prestigious Health Service Journal Awards. What made it special was the fact that it was given in recognition of this staff engagement journey. We were also really pleased that the results in the 2019 NHS staff survey showed tremendous improvement. Not only did we achieve the second highest response rate in the country, we were above the national average in 9 out of the survey's 11 categories. You'll see the reference along the bottom of the slides to our annual report, so you can read more of that detail about how we've improved how we look after our staff. Their health and well-being is at the heart of everything we do, and will be even more important for us for years to come as we work through the legacy of the COVID-19 pandemic. In fact, COVID-19 has tested us all, throwing up unprecedented challenges across the Trust, including, and maybe none more so than in A&E, where the team looked after more than 90,000 patients over the last financial year. So before we take a look back at patient care, here's one of our emergency department matrons, Kay Smedley, to share her team's experience of COVID and to tell you more about the changes they've had to put in place to keep people safe.
I'm Kay Smedley and I'm matron for the emergency department. In the very beginning, we were seeing more red patients than green patients. A red patient would be somebody that we suspected of having COVID. So anybody without a temperature that hadn't returned from one of the affected countries was, for example, an ankle injury with normal observations, they would be a green patient. We had to make the capacity for those patients that potentially could be infected. So initially we had a small red area down in the new build of the department and the rest of the department was green, but then we moved the green area into fracture clinic and made the whole of the department a red area, so that was the first thing that we did. There was quite a few measures that we implemented. So communication's the key, so ensuring staff knew the regular updates that were coming out and what they needed to wear. So we have daily huddles every day, emails to staff to let them know that they should be wearing a face mask, gown for X patient, gloves for Y patient, and when they needed to wear full PPE. It was a very challenging time, but I think the staff naturally just pulled together because it was so unprecedented, nothing that anybody had ever seen before. And I think when we split the department and people were working in smaller groups, that helped. So the response of the community was fantastic, and that really lifted staff spirits, so they felt like they had a real purpose when they were coming to work. There's been negative press about NHS in the past, and I think they really felt like they had a purpose.
In the performance section of this year's annual report, you'll see that once again, finances and operational delivery provided some challenges for us. At times it was difficult to balance these against our desire to strive for high standards of patient care and an exceptional patient experience. And this year, as a board, we took decisions to invest in some services to ensure we maintain both. We felt that spending money on additional staffing, especially to support A&E, nighttime nurse staffing on the wards, and to provide more consultant cover, was the right thing to do, even though we accepted it would impact on our finances. We didn't meet some of the national performance standard this year, including the 4-hour wait in A&E, but we are pleased that our patients still found their experience to be a good one. Our friends and family test results throughout the year showed high levels of satisfaction. Some areas of the hospital had a 99% recommendation score, and it's good news that so many of our patients would recommend us to others for the care and treatment that we provide. The views of our regulators, including the Care Quality Commission, also help to illustrate the quality of care we provide to our patients. Last year, our Royal Primary Care Services led the way in attaining good ratings. All of them, 8 surgeries looking after around 40,000 patients, are rated the same, providing assurance to service users. In August 2019, the CQC also held an unscheduled inspection in our emergency department, highlighting a number of issues relating to the environment that required immediate improvement action. Some of these were resolved within 24 hours, and all issues were completed a few short weeks later. And although the final part of our inspection process by the CQC could not take place in April because of COVID-19, we were still awarded a rating maintaining an overall score of good. We're incredibly proud of all our staff who work so hard to provide the best possible care. And in the middle of March this year, preparing for COVID-19, 2 areas of our hospital, medicine and critical care, also faced an unknown situation, setting up services for patients diagnosed with coronavirus, knowing little about the virus. In these next 2 videos, we hear stories from matrons Tracy Forrester and Maxine Hardy, both leading teams caring for patients with confirmed COVID-19.
I'm Tracy Forrester. At the time of the first COVID ward, I was a matron on there. Well, as soon as we had the first COVID patient, I got a phone call. It was approximately mid-March, saying could I be the matron on there and would it be possible to open that ward hopefully that day. It was quite a smooth transition. Staffing wise, we got staff that volunteered to work on the ward, which made it a nice environment to be on. Staff morale was kept up really by the support agencies that the Trust put on, outside agencies. We had a daily meeting, 10-15 minutes, for staff to come together and just let off steam or any worries that we had. We were able to communicate and try and support each other the best we could. To keep patients and relatives updated, the doctors would phone relatives whenever they could, and we also had use of iPads, so patients could speak to their relatives, and it boosted the patients and kept their relatives informed as well. The support we had from outside, from the community, was immense. You know, the clap for carers on a Thursday boosted our morale. The drive-through that we had from other services, the gifts that we had was just tremendous, and we probably couldn't got through it without their support. It really meant a lot to us all. Well, the experience, it was challenging to start with. Yeah, we were all going into unknown territory, but the team as a whole did an amazing job. The hospital as a whole did an amazing job, and we got through it together, and I think we did quite a successful job treating these patients and getting, you know, the majority of them home.
My name's Maxine Hardy. I'm the matron for critical care at the hospital. The Trust as a whole were preparing for the patients that would be arriving in the Trust, and we knew in critical care that we would be seeing a large number of critically ill patients with COVID-19. So initially HDU was turned into our isolation COVID unit. This required support of everybody, so estates came, put up walls. We had lots of teams supporting us to try and adapt the unit into a safe area, not only for patients but for staff as well. We'd got to have designated areas for staff to don PPE. We had to have a specific area for doffing, so taking off the PPE appropriately, hand washing facilities. A lot of areas in the Trust were contacted to ask if any staff would volunteer to join us in critical care. As supportive staff, we realised that these staff members have not worked in critical care before, and they would be supported by the critical care trained staff. So initially HDU was our COVID area, but quickly numbers of patients escalated and we had to make a further unit. So the intensive care unit then became our second COVID area. So it was a very busy time initially, but the Trust as a whole really came together and supported us. We did run some support sessions as well within the Trust for staff that just needed that one-to-one time to talk things through with somebody. The Trust also had support from Ashgate hospice counsellors, and we had specific group sessions that staff could access from critical care. I think staff morale has been wonderful. I think we've done really well. So, yeah.
As North Derbyshire's largest employer and seeing more than 400,000 patients a year, we want to not just be a hospital, but part of our community. In the annual report this year, you'll see that we're not just treating ill health, but helping people to lead healthier lives by encouraging people to take up exercise, stop smoking and reduce their alcohol consumption. We're also supporting initiatives that reduce our impact on the local environment, working with others to offer discounted public transport, cycle to work schemes, and buying supplies from local contractors, especially in our retail outlets. With a fruit and veg stall outside the main entrance 4 days a week, offering healthier eating to everyone, and we've complied with new standards to sell fewer sugary snacks and drinks on site. This year, we've also been fortunate to continue to benefit from the support of our governors, who, as part of our council, have worked alongside us to improve patient experience, safety and clinical effectiveness. We're proud that our governors have an active role in the Trust, representing their constituents and our patients. At the start of 2020, we were also awarded the Investors in Volunteers Kite Mark, only one of a handful of NHS services to achieve this accolade. We've now around 150 volunteers registered with us, aged from 16 to 90. They give their valuable time to enhance patient care and support our staff, and this achievement recognises their value and the Trust's commitment to ensuring their experience is just as good as that of our own staff. And of course, as well as providing services from the hospital, we reach out into our communities with GP and primary care services, midwifery, children's services, therapy services and more at bases and visiting homes across the North Derbyshire county. COVID-19 provided just as many challenges for these teams as well. And in these next two video stories, Head of Nursing and Midwifery, Julie Mycock, describes the new normal for maternity during COVID-19. Unfortunately, there's no pausing babies that are ready to be born during a pandemic. And our GP and staff governor, Dr. Ruth Bentley, explains how the team at Royal Primary Care managed GP appointments as part of our response to the pandemic.
My name is Julie Mycock and I'm the Deputy Head of Nursing and Midwifery. At the start of the pandemic, it was very challenging for all of us. We actually telephoned all our women before they had any appointments and explained the process of what would happen when they came in around washing their hands, wearing the masks, the questions that they may well be asked as they come into the department. So the way we manage social distancing through our services was very much about, particularly in our antenatal services, about women coming to their appointments. We actually phoned our women when they were outside in their cars, when it was time to come in for their appointment. So we had very minimal numbers of women within our waiting areas. The whole of the team have shown such resilience. They've been courageous, they've been positive. It was International Day of the Midwife at the beginning of May. They put together what is, I think, an amazing piece of footage, video, that should be widely shared with women, and it was about reassuring women how they were going to be cared for, how they were going to feel safe, and it was just uplifting and inspiring. So I have to say they've been absolutely wonderful.
Hello, my name is Dr. Ruth Bentley, salaried GP at Royal Primary Care and Staff Governor for Community and Primary Care at Chesterfield Royal Hospital. As soon as lockdown came in, we were unable to see patients face to face. Effectively, the doors were locked. The default is you have a phone consultation with a clinician, whether that be a GP or one of our ANP colleagues, and a decision is made if you can be safely treated over the phone or if that needs to be a video consultation. Texts go out to patients saying please don't arrive more than 5 minutes before your appointment. There's also been the facility to be able to send in photos to a dedicated email address, which again has been really invaluable, and to be able to share those with secondary care colleagues, particularly in dermatology, which has been awesome. Our excellent staff are brilliant at meeting people at the door, just confirming that they have an appointment or if there's anything else they can help them with, making sure they've got a mask and hand sanitizer, and asking them to just wait in the waiting room. The patients have been really good actually. There's been frustrations, but they understand in the main that this is to keep people safe. The team has coped extremely well with dignity, with professionalism, and with a good sense of humour. But I think that in many ways this has brought us closer together. So it's really good to see that when we face a challenge, we will pull together and we will work our way through it to continue to deliver excellent care and support each other as staff.
Our resources, workforce, finances, our sites and our partnerships have never been more valuable, and this year we've worked incredibly hard to use them wisely. In our annual accounts, you'll see that despite the challenges of COVID-19 in the last 3 months of the financial year, we managed to break even. No small achievement on a budget of more than 270 million. You'll also see that we've invested around 10 million in the estate, new equipment and technologies. This includes a new patient observation system, and you'll see staff using iPads to record patients' vital signs, such as their temperature, blood pressure and oxygen levels. The nursing team can summon medical teams to patients who are deteriorating using the system and without having to leave the patient's bedside. Called EOBS, it's one of the best digital developments we've seen for improving patient care. The relationship we have with health providers, primary care, social care, the voluntary sector, commissioners and others have never been more crucial either. This year, for all of us in the Joined Up Care Derbyshire partnership, has been one of greater integration to improve both service provision and the health of our populations. The COVID-19 pandemic has brought us all closer together, and there's been much more mutual aid and support. We are definitely starting to see the difference system working will make as we all set out to meet the aim of the 10-year plan for the NHS. Much of what we've achieved has come about because of coronavirus, which forced us to think about adapting how we work really quickly and how we work well together. In our next story, Associate Director of Strategy and Performance, Maria Riley, explains how outpatient services were adapted to make sure patients could still have their appointments without risking a trip to the hospital.
My name is Maria Riley. I'm Associate Director of Strategy and Improvement for the Trust. So our outpatient services at the Trust, we took quite a different approach in terms of responding to COVID. We didn't go ahead and just cancel appointments like a lot of trusts did. We quickly tried to convert all of our outpatient appointments into either a telephone consultation or a video consultation. So in the first few weeks of the COVID response, we converted thousands of outpatient appointments into telephone or video, and took the approach that even if a patient was just getting a reassuring phone call from us and we weren't able to clinically progress their pathway, that was better and the patient would understand where they were in the pathway. We converted from 4% to 86% of our appointments being delivered virtually in the first 4 weeks. So that means we didn't stop services, we carried on, and that's put us in a really good place in terms of restoration and recovery of services. So we're carrying on doing what we did in terms of delivering telephone and virtual appointments, but we're extending how we can use those into innovative new ways. So enabling patients to set up their new equipment at home rather than coming into the Trust, and just expanding our use of it into new areas. So you will see a difference if you come in for an outpatient appointment at the moment. We've put arrangements in for social distancing, so we might ask you to wait in the car or to wait at the front entrance of the hospital until we call you in, and that's just about us ensuring that we have the safely number of people within an outpatient area at the time. Our outpatient teams, the service managers, so our administrative staff and our clinicians have been absolutely fabulous. I'm so proud of the response that they put together. They came together, collectively worked together to put the patients at the forefront and make sure that we could either reassure patients or that we could still get the patients through the service. It's been a fabulous effort and I'm really, really proud to have been part of it.
Last year, we set up an improvement academy, a one-stop shop where any colleague can seek and receive advice and help. We've used the principles of listening into action and quality service improvement and redesign to train, develop and educate our staff. Our programmes and improvement forums are accessible to everyone. As you read through the pages of the annual report, you will see how this approach has paid dividend. The news section reveals a host of stories that illustrate how staff have given our patients an even better experience. Not all ideas have to be large-scale and complex, like the EOBS development I described earlier. A new patient menu, created with patients, visitors and colleagues, has really made a difference, catering for all tastes and dietary options. With just a few simple changes, there have been big improvements with positive feedback for both the meals and the choices on offer. Our ultimate aim is to improve every day and every one of us can help to make that happen. The Improvement Academy will become even more important in the coming year as we look to restore our services back to full capacity, and we look to be even more creative and innovative about how we work. We know that we cannot slip back into how things were. COVID-19 has changed the way the NHS has to work probably forever. In these next two clips, you'll hear from matron Claire Davies, who describes how COVID-19 has changed the way endoscopy works in our restoration plans. Research nurse Vittoria Soracci shares the story of our research team, which we've been building and improving over the last 4 years, and explains how COVID-19 has put it on the map.
My name's Claire Davis. I'm the endoscopy matron. COVID-19 impacted on the service. All routine, urgent and target activity stopped. Only inpatient activity continued initially. To get the department back up and running, we had to do risk assessments of the environment to identify a safe way of working, to ensure that we were social distancing in the environment. We developed some COVID-19 questions to ask all patients to ensure that patients were assessed prior to attending the department. We had to do guidance for staff regarding the appropriate use of PPE in order to ensure that we'd not got too many patients in recovery. We had a reduced number of bed spaces, so we had single sex lists to see how that worked. And actually now we're back to having male and female recovery areas. How have staff coped and how are they feeling at this stage? I think staff generally have felt supported by the general public and I think by the trust, but obviously have really struggled during this period, and we've had debrief sessions for all staff, which I think have been evaluated positively. But I think there are some ongoing issues with some staff and they've needed continued support, and I'm sure that that'll continue.
My name is Vittoria Sorice. I'm a clinical research nurse here at Chesterfield Royal Hospital. We are actively recruiting patients to COVID-19 studies and other urgent public health studies. Some of the studies that we're recruiting for are recovery, which is the one looking at different treatments that may or may not work in the cure for COVID-19. Then we've got midwifery studies like Pan-COVID. We've got ISARIC, which is just data collection at this hospital. We are a very specific research department because we actually integrate primary care research as well. And so we got the principal study that is running in research. So we're still running COVID-19 studies, and we're actually, now is more important than ever to actually enroll in these studies, because with the fewer numbers that we're seeing, which is a really good thing, it's even more important to collect the data for the patients that are actually affected by it. The support that the public has given to the research department and to the hospital in general has been incredible. We have been able to recruit about 30 to 33% of patients coming through the door with COVID, which is a huge number, is about double what other hospitals have been able to achieve, which is amazing for such a small hospital, a district hospital. We cannot do research without patients. Thank you for taking the chance of doing clinical research, for enrolling voluntarily in the study. And I want to support anybody else who wants to help us out to keep enrolling in the studies, because now it's more important than ever.
This year, we are basing our improvements on the lessons we've learned throughout COVID-19. The changes we are implementing as we look to restore and recover our services will make the most of technology and digital developments, will continue to enable staff to work effectively from home, and will invest in the equipment, facilities and services that will make the biggest difference. We're still planning to build a better A&E, to create new staff facilities and to do more outside of the hospital's four walls. But we can't necessarily tell you when these plans will become reality because of the challenging and uncertain times we're in, and the rest of the NHS are in at the moment. Just this week, the government has tightened restrictions, as we know, to try and combat the spread of COVID-19. None of us know what might happen next, but with the help and support from our patients, staff and communities, we can protect our NHS. We're grateful to everyone who has helped by wearing a face covering, washing their hands, and has maintained social distancing. We're also grateful for your understanding around visiting and coming into hospital to support a loved one with their appointment, as we know how hard this feels. We're urging people to use our services wisely, to get a flu jab this year, and do everything they can to support us. Right now, we're talking to staff, patients and visitors about our new 5-year strategy, and it feels like there's no better time to decide what sort of trust we want to be, how we're going to succeed, and what values we want to live by. We know that many of you still feel nervous about coming into hospital, and we understand why. Throughout COVID-19, we have never been closed though, and anyone who needed critical medical care and support has received it. I hope you've enjoyed hearing about our 2019-20 and COVID journey. In our last video for tonight, our acting chief nurse, Sarah Ward, aims to put your mind at rest by explaining what we've done to keep you safe and protected.
Hello, my name is Sarah Ward and I'm the acting chief nurse here at Chesterfield Royal Hospital. The last 6 months have been really challenging, and I wanted to thank you all for helping us through our COVID-19 response by keeping to the government guidelines and supporting us throughout. I also wanted to take a moment to update you on the services that we're still running here at the hospital so that you can access them when you need them. First of all, as you would expect, we ask anyone who comes into the hospital to wear a face covering. There are stations at each entrance where you can pick up a face mask if you don't have one. You will also need to sanitise your hands at these stations. We have a series of one-way systems in place and ask you to keep to this wherever possible to maintain social distancing and keep you safe. Regardless of whether you have got symptoms of COVID or not, patients coming into any major department will be cared for in a safe place. If you're concerned about symptoms, please contact your GP and they will discuss this with you. If the decision is made that you need to have an appointment with the hospital, we will contact you directly to have a discussion with you either by telephone or on a video conference facility. You'll receive a letter explaining this for you. If it is decided that a face-to-face discussion needs to happen, then be assured that coming into hospital is perfectly safe. We are also asking you to make sure you look after your own health. If you do have symptoms that you would normally contact your GP about, then please contact them. They'll be able to discuss this with you, and if needs be, will direct you to the hospital if they feel you need a diagnostic test. We will do that in a way that is as quick, easy and as safe as possible. It may be that you can drive in and are directed straight to our scanning services, in which case there'll be no need for you to come into the main hospital at all. It may be that you have taken the decision to continue shielding. If you need to come to hospital, we'll still make sure that we apply the same principles that you would do whilst you're at home. There are options, including using a side room wherever possible, providing you with personal protective equipment, and our staff will also wear that equipment to keep you safe. And finally, if you are concerned, contact 111 or your GP to discuss your concerns. Keep yourself safe, but above all, remember, if you do need to come into hospital, we will keep you safe and we are here to help you.
Well, I don't know about you, but I really enjoy those videos. I know it's not quite the same as being with us in person this evening, but I feel they've given a great flavour of the year we've just concluded. So thanks to all my colleagues who helped put those together. Listening to Maxine, the matron of critical care, it was lovely to hear her describe how people volunteered to be on the front line of nursing very ill COVID-19 patients. What she neglected to say was that her roster normally runs to 60 nurses. And at the height of COVID-19, we needed 160. And all of those 100 people were volunteers, and they volunteered virtually overnight. And we were particularly pleased, and I have to say proud, that nobody on that roster suffered COVID-19. So everything you heard about donning and doffing and the procedures for personal protective equipment were carried out really rigorously. And having looked at the donning and doffing areas in ITU, I did notice that the procedure had been written up on a whiteboard, and I had more than a little giggle when I noticed that the last line in this procedure was an instruction to our staff colleagues to have a wee and drink a tea. Such was the intensity of the work at that time that they had to be reminded to look after themselves. Further evidence, if it was needed, of the magnificent effort by everyone right across the Trust. So a huge thank you. We're enormously proud of you, and we're very grateful for everything you've done. So now comes to the part of the evening where we'd normally be taking questions. We have given you the opportunity to put questions to us in advance. So the questions that have been put to us in advance of tonight, we've themed and grouped and put on a series of slides, which we're just going to go through. And of course, there's still the Angie about how things stand today.
Thanks, Helen. So today we've got 4 inpatients with COVID-19, one of whom is in intensive care. That number's varied over the period since the end of March, where overall we've treated 721 COVID positive patients, 582 of whom we've discharged. 139 have sadly passed away, and they were recorded as COVID-19 associated deaths.
So certainly seems to be a more favourable position at the moment than we were experiencing at the height of the outbreak, which is good to know. The next set of questions we have are all around recovery and restoration plans, and what are we doing to get all our services back to pre-COVID capacity. So a sense of that, Angie, would be really helpful.
And I'll keep an eye on the time, because I could talk about this one all night. And another big thank you to all of the staff who've supported us with getting services. I won't say back up and running, because as you heard in the slides and the videos, we've continued to provide a lot of our services. So the restoration of services has been a focus nationally around making sure we're getting all our services back up and running. And there are standards that nationally we've been set to get all those services back to pre-COVID levels by October. So if you think about our emergency services running as they always have, with the challenges that you've heard, we're probably up to about 90% of patients back through A&E compared with last year, some days almost the same. So those services are running as, if you like, normal. You heard about the outpatient work, particularly proud of all the work everyone's done to see our patients virtually or speak to them over the telephone, which has meant that we have maintained the majority of our outpatient services, and our work now is focusing on which of those services do we need to see patients face to face, and how do we find that balance of keeping some of those outpatient appointments via telephone or video, because we've received some really positive feedback from patients and from our staff, but clearly there are some that we need to see face to face. Our primary care teams, again, back to almost normal, if you like, levels in terms of the number of appointments they're able to offer. And you heard from Ruth earlier in terms of how we've been doing that. And again, where we need to see you face to face, we have always done that from a primary care perspective through something called Red Hubs. So urgent clinical patients, if the GP needs to see you, we have seen and will continue to see. The biggest challenging area, I think, has been our planned care. So for those patients who are on a waiting list for a procedure, we've prioritised those in terms of the clinically urgent, as you would expect us to. So our cancer patients have had priority, or those patients needing really emergency treatment. Some of those patients as well have had to wait a little longer. And Sarah's video is quite timely because patients are still afraid sometimes to come into hospital. And so that message about do please come if you need that treatment, we are here to provide it. And we've seen those waits for all our patients starting to come down. And I say our focus now is making sure we've got all our services back up and running. And I know the one I wouldn't be allowed off stage because we've had a number of people ask us around when hip and knee replacement surgery is starting any time now. So that I know has been a wait for some of our patients, but patients are booked in and have been screened appropriately and will be coming back through our doors. And just my last comment is that we are working as part of the Derbyshire system. So that where we can work jointly, whether that's with our community colleagues, mental health colleagues, or colleagues at UHDB, to make sure that we manage all these services in appropriate settings, then we're continuing to do that.
Yeah, well, that's really good to hear that picture, and indeed the huge amount of work that's been done so that we have a good degree of confidence of hitting a kind of full pre-COVID levels by October. So we'll be keeping our foot on the pedal on that one. The next series of questions relate to, I suppose, a concern, particularly if we get a second wave of COVID-19 that coincides with the normal winter pressures, because it can be quite pressurised just dealing with a typical winter, let alone a winter that might coincide with a second wave. So there have been a number of questions about, in that circumstance, how would we cope? And there was one particular question saying that they'd seen some modelling that suggested that quite a number of trusts were going to be under severe pressure in that scenario.
Yeah, and again, links very nicely with the previous question. So in terms of getting all our services up and running in a COVID world, where again, you heard from the videos, all the extra PPE that you need to put on, the social distancing, means that the number of patients we're able to see in a clinic or on an operating list or in a GP practice is reduced. So, and what we'd normally do as part of our plans for winter is reduce some of those routine operations and procedures so that we can cope with that demand that inevitably we see through winter. And clearly we don't want to do that if at all possible this year, so that we continue to catch up and reduce those waits for those patients that have had to wait through the pandemic. So a key part of our winter plan is balancing what that routine work looks like. Inevitably, if a second wave, when it lands, how that manifests and impacts on the hospital will then influence that elective programme. I hope we don't get a, if you like, normal flu, and our message encouraging everyone to have their flu vaccination this year is that message that what we don't want to do is find that we're trying to run all our services with a flu, with a COVID surge again, and we're trying to manage an EU exit, as people keep reminding me on the 31st of December. So winter this year looks very challenging. There's lots and lots of work going into that modelling that one of our questions referred to, again being done as a Derbyshire system. And literally, as I speak, I know the teams are still meeting and talking around how we make sure we find that real difficult balance between modelling what we need and how we deliver that through all the scenarios. And as you'd expect, we've done what we think will happen, and then a worst case and a best case scenario. And we'll keep that under constant review as a system. We meet regularly. I'm sure during winter it will be back to daily to make sure that we're all working as a system to support all our patients, however they come through the door.
Yeah, and it's been great to see that, hasn't it, over, as you said in your earlier remarks, over the period of the last 12 months, how we have really rallied together. Now, I feel we're getting off somewhat lightly tonight, because normally we get a bone of contention and concern at the annual members meeting about car parking charges. So we haven't had any questions in that vein tonight, for obvious reasons, because there has been no car parking charges during COVID, and with the bill that's going through the House, possibly none into the future. But this is the other chestnut that does concern members about smoking, sometimes directly outside the trust, despite the fact that we have big signs and loud hailers and all the rest of it. So disappointed that we're still in this situation, but not surprised to get the question.
Yeah, and I wish I had the perfect answer, as I know not only ourselves but every hospital up and down the country. You may remember last year's annual members meeting and a few Council of Governors meetings. We talked about having a big conversation with everyone so that we could get some feedback and ideas. I'm pleased to say we did have that literally just before COVID struck and lockdown. So we haven't had chance to go back to that and think about all the suggestions and the comments that people made. So we will do that, and apologies that we've been slightly distracted with other things. It is a bone of contention in terms of what we face every day. I understand the challenge that some patients have if they're facing a very difficult news being broken to them, or their end of life, then to want to be able to carry on doing what they've done for years is understandable. How we find a way to support them through that is a really difficult one, and I completely understand the unacceptability, because it always seems to be at entrances that people congregate. So we will continue to try and see both sides of the challenge, work through it, and in particular get back to looking at some of those suggestions that came through that big conversation.
Yeah. And in the longer term, of course, this chimes with everything you've said about our agenda for preventative health and healthy lifestyles. And, I appreciate that's longer than we want to wait, but that's going to be really transformative and important in the longer term. So the next group of questions is from a staff colleague of ours, and it's asking about Joined Up Care Derbyshire. So we've talked a lot tonight about the system and how we're working as a system, and increasingly working really effectively as a system. So they'd just like to know a bit about where we're up to and what comes next in terms of Joined Up Care Derbyshire.
Thank you, and thanks for the question, Michael. In terms of what that means, Joined Up Care Derbyshire is an STP currently, which will become an ICS, an integrated care system. There is a national process that is defined for each system to become a formal integrated care system, and Joined Up Care Derbyshire is going through that at the moment. I'm conscious I'm having to speak very slowly and trying not to do acronyms for Lauren, you're doing a great job there. So what that means in effect is there is a process that will support us as Derbyshire working together as a system and formally recognised as such by NHS England and Improvement. We're aiming for that to be completed so that we are an integrated care system by November. So that will give that signal, if you like, that we are formally recognised as an integrated care system. Without going into all the detail of what that actually means in practice, there is no legislation to give that ICS formal accountability. So we will still be individual organisations with our own accountability. But what I hope and what we all believe is that support to work together, and what we've really seen through the pandemic, how we've worked across not only health but local authorities and voluntary sector and all partners, will be built as we get that formal recognition of being an integrated care system.
Very good. I'm going to give you a rest on the next one, because the next question is about membership and how we're going to keep connected with our members over the next 12 months. And I'm hoping with a good degree of ease. We got lots of guidance from our colleagues at the centre during the course of the last 6 months in particular about how to socially distance and what to do about board meetings and committee meetings and Council of Governor meetings. And to be honest with you, everything that arrived, we were able to say, well, we've never stopped ours, or we've already done that, because we managed to go across so quickly to doing virtual meetings and working off the kind of digital platform, that I feel really we didn't break our stride in terms of having that ongoing connection. Now, I appreciate it hasn't been easy, and there have been, for instance, a number of governors who've said, listen, it just doesn't work for me trying to connect with the hospital in that way. But for the vast majority, they have been able to make that transition. And I think, as I said in my opening remarks, that's been really important, because, just at a time of crisis is not a time at which you don't find yourself held to account. And governors in particular have such an important role in holding the trust to account. The fact that that could be very competently and ably discharged over the period, albeit virtually, was really good. We have also managed in the last few months to prepare a revised membership strategy. It's for the trust really to prepare a membership strategy, because then that gives governors something to work with and within in terms of outreach and engagement with the community. And to be honest with you, we've had such fabulous communication and feedback from patients and from the population we serve. We thought, we really don't want to lose this. We need to be finding new ways now over the next 12 months to keep this going. So we're going to have a much better area on our website. And, we had a particular question in this regard about training members can do online or otherwise. And, that's a great suggestion. We don't at the moment. But with this new area on our website, we'll absolutely be able to put up some relevant links and keep evolving the offer and making sure we're staying connected in a whole range of ways. So you're on the last question of the evening, Angie. But it's a big one. We've been asked about our future plans for next year and beyond.
It's a big one, but a good one, because it gives us an opportunity to plug our strategy, which we're just embarking on our new 5-year strategy. So our current one runs out this year. We've done some work we had started it pre-COVID, talking with partners and some of our staff around what it needs to look like. Those staff members who are watching will know that they've got the opportunity at the moment to feed into some of that initial work around their clinical services, all the good work that you've heard about how can we deliver services and develop them over the next few years and beyond. All of that will be collated together in our strategy. And importantly for us, being clear about our mission and our values, what's really important for us in the way that we deliver care for our patients and look after our staff. We'll shortly then, so a heads up for everyone who's not a member of staff, that we will then be coming out to talk to all of you, governors, members, stakeholder, colleagues, about your input into that draft strategy and how you want to help us shape that going forwards. In terms of what the main plans are, the immediate ones, I think we've covered them in terms of right now getting our services restored as best we can in current environment, learning those lessons from COVID. There's been some fabulous work. There's been some things where we haven't got it right and where we've learned from, and how do we make sure we build on that learning going forward? How do we plan for winter and that second potential COVID wave, for a flu? All of those are our immediate priorities to make sure that operationally we keep all our services running as best we can and keep our patients and our staff safe. We can't do any of this, as you've seen tonight, without our people. Their health and well-being, as I said earlier, is fundamental to us. So there's lots of plans in place to continue the work we've done around supporting staff health and well-being. Some new ones to think about, and we've got support from Westfield Health to provide more offers to our staff. and continue on our journey of improving that engagement again that you heard about earlier, and making sure that I know this is the best place to work, but just making sure we continue to keep that the way, and that everyone feels that way too.
Thank you very much, Angie. So it just remains now really to wrap up this evening. You've heard Angie be fulsome, and quite rightly so, in her praise and appreciation and gratitude for everything it is staff have done over the last year, and particularly over the last 6 months. I hope I've managed to convey to our members and to the wider community how hugely supported we felt by you, both practically and in terms of your kind messages and sentiment that have meant such a lot to us during what has been a difficult time. But there's a few more thanks. I mean, Angie talks about the last year. We mustn't forget that Angie has only been with us a year. Hard to believe. I'm so pleased, Angie, when you came, that you set out to personally have a conversation with all 3,500 members of our staff, because I think that stood you in really good stead. And, you've led this whole effort very ably and convincingly. And we're very grateful for the manner and style and determination and an effort you've put into that. It's been hugely appreciated. So well done, you.
Thank you.
Another big thanks has to go, of course, to our governors. Governors are the link between patients, members, the wider community with the trust. And it's a very important connection. And I'm very grateful to all of our governors, but I must say a particular word of thanks to our lead governor, Denise Foremchuk. Denise stands down after serving a full term as our lead governor in December this year. And I always say that Denise was a very senior nurse at an adjacent hospital in her professional life. And colleagues will know that I describe her ability to call a spade a shovel without ever giving offence. And she has been very able in leading the challenge and support that we have enjoyed as a board during the period of her time as lead governor. So we're very grateful to you, Denise. I'm only sorry that we're not all in the room to give you a very well-deserved round of applause, but I very much hope that before long we will have that opportunity to say a big thank you to you in person. And of course, a big welcome and hello and a thank you to Margaret Rochelle, who's going to take over in your place and I'm sure do very well. So final thanks to the people in this room that you can't see, including Sarah Turner-Saint and Nicholas Smith, who've been beavering away on the systems. The communication effort over this period of time has been phenomenal. I realised that I think it was in July we managed to reach just shy of 1 million people in terms of our presence on Facebook. We've had to adapt, but by goodness have we managed it. And the whole focus on communicating in a different way, including tonight, has been much appreciated by me, and I hope and trust by you. And a thanks again to Lauren and to Sean, who was with us earlier, to sign this event. So it's we've enjoyed being with you, despite not having seen you in person. We hope you've had a flavour of what it is we've been up to, and before long we look forward to seeing you in person. Take care and thank you.